Well, hello everybody, and thank you for being here today. My name is Ahmed, and that's probably why I got first, because my name starts with an A. It happens to me. Um, so I'm a cardiologist who is specialized in both heart and peripheral vascular disease interventions. And today I'm just going to talk for a few minutes about deep venous thrombosis. So we start first with what is a deep venous thrombosis, or a DVT for short. We have two types of blood vessels in our body, and the first type is the artery, and the second type is the vein. The artery takes blood from the heart and takes it to your entire body. So that takes nutrients and oxygen to all your body. And then you have the vein, and the vein is basically the exhaust. So it takes the blood that is now doesn't have any oxygen and nutrients and bring it back to your heart to be recycled. So you have two systems, and both systems has to work perfectly so the cardiovascular system keeps going. So the veins, as we see here, these are veins in the legs, and this is the normal blood flow. You see there, right, the next image here is the normal blood flow. So blood is going from the feet and going all the way up to the heart, where it can be recycled after that. There are some valves, and these valves are really tissue paper thin. And these valves are one-way valves that prevent the fluid and the blood from pulling down towards the feet when we stand up. So they work against gravity. The image right next to it is a vein with a blood clot, or a thrombus, or a deep venous thrombosis. And as you see, there's all that red stuff is a blood that is clotted within the vein, and then they start damaging these really thin valves. And once these valves get damaged, they can't work as a one-way valve. What does that mean is once you stand up, now gravity works to pull the blood down towards the feet. Now there's another thing that can happen to these clots, which is basically the clot can detach and break and travel all the way back to the heart and then to the lung, and that's usually a bad situation where there's a big clot in the lung and people can get bad complications from that. So how do we know? How do we know if somebody has a deep venous thrombosis or a DVT? We start first by the symptoms. So what are the symptoms that will make me think maybe somebody has a clot in their leg? So these are the symptoms, and they're basically aching, pains, cramping, discomfort, swelling, all these symptoms that people feel when they get a clot in their veins. And also when I touch, it's tender to touch, it's hot, it's warm, and these can sometimes happen suddenly. So somebody wakes up from sleep, or right after a very long travel or a car ride or something like that, and then all of a sudden, oh boy, my leg is hurting and swollen, I don't know what's going on. So that's when we have to be a little suspicious. The next step right away is a very simple test. The diagnosis is very, very simple. First of all, you have to suspect it, and then the second thing is you get an ultrasound. So a 5-minute ultrasound will give you the diagnosis of deep venous thrombosis and kind of confirm it or rule it out. So because there are other conditions where we can have the same symptoms which are not deep venous thrombosis. So that picture really summarizes what happens weeks, months, or even years after the blood clot. So as you see in this picture, there is still swelling. This could be 4, 5, 6, 10 years after you had the blood clot. So you still have swelling, you have pain, you have cramping, and you have tingling, and also you have this discoloration, the kind of brownish, reddish, blackish color of the leg. And there's an extreme of that. So the extreme is really when people start having breakdown of the skin of the foot or the leg, and they have ulcers that are not healing, because usually when we get a little breakdown in the skin, they start healing pretty quick. But if you have problem with the vein flow, then this ulcer will not heal as good as it's supposed to. So we have been treating deep venous thrombosis the same way. It's been decades since we actually figured out a better way to treat them. So the treatment was giving a blood thinner and then using compression stockings. So the blood thinner is basically the medications that will thin the blood enough so the body will not form a blood clot. And these medications, although they're very good, but they don't solve the problem right away. What the blood thinners do is they prevent the clot from getting bigger and travel other places until your body uses its natural mechanism to dissolve the clot and just reabsorb it into the body. So it will take time. It usually takes several weeks for the body to take these clots back and absorb them and take them away. While we're waiting for that, guess what happens? What happens is these thin valves in the leg get destroyed. Once they get destroyed, that's permanent. That's permanent damage. They don't come back, and there's no way to prevent the blood from pooling back down in your feet and causing all these problems. So that's one. The second thing is the compression stockings, and these are basically socks that are very tight. And why are they very tight is because they're trying to compress the muscles in the leg and compress the veins within these muscles and prevent the blood from going down towards the foot. So these compression stockings are working against gravity. A lot of people come back to me to the office and say, well, I can't do it. I just cannot do it. They're too tight, they're hot. Now, we're gonna just give you a little demonstration of how this thing works. So basically, the way I do is somebody comes to me with a blood clot. I go in with a catheter. That's your catheter right here. This is the vein. You see the blood clot, and you also see the valves that we talked about. So I go in there with a catheter, and then I inject a medicine. So that medicine is called a lytic, which is basically a clot-busting medication. It makes the clot soft and mushy. And then I wait for about 30 to 45 minutes, and then the next step is I go back with the same catheter. The catheter has a big hole on the side there, and it works like a little macerator. So it macerates that soft, mushy clot. And then I pretty much aspirate and suck that clot inside of the catheter and take it out of the leg. So in a matter of about 35 to 40 minutes, I got the vein back. It's clean, the blood is flowing very well, and the valves will be restored so they're working again. So why is this technology? This technology is basically invented to prevent people from having problems from the deep vein thrombosis that will last for life sometimes, and is very expensive to treat, and it's very difficult to treat, and really people feel debilitated, in pain, and swelling all the time. So the message here is, if you have these symptoms, if you start feeling symptoms that we just talked about, the pain, the swelling, you talk to your medical provider, and then they will take it from there. They will get an ultrasound. They'll make sure that there is the diagnosis. If you have a blood clot, then they will contact us. And depending on how big this blood clot, people might benefit from this. It's a procedure that it takes one day. Basically, you come from home. It's an outpatient thing. We do it. We watch you overnight, and we send you home the day after. But with this procedure, we might be preventing a lifetime of pain and swelling and ulcers, and sometimes really loss of feet or fingers or toes or something like that. So we do have that at Heart and Vascular. We're very proud to have this technology there, and all we hope for is to help our community avoiding the complications of deep venous thrombosis. Thank you very much.